how do you use Estill qualities in your therapy? They say that, a lot of it's easy for the figures, because we can identify structures and help people find them. But how would you use qualities in your practice?
Qualities are a great place to start with stimulability.
Mm.
If you are trying to trial something out, I think that it's a really good place to start with that. Um, the figures are so integrated within the qualities. It's kind of hard to say which one. Like I'm using just a figure condition because it's so integrated into a quality. But sometimes when somebody a client's learning and they kind of understand it more conceptually as a whole, and the quality makes more sense to talk about in that way, and breaking it down into component parts makes it a little bit more difficult for like individual figure condition learning. I'll utilize a quality to give it a name. Like we're going to use this like twang,
Right.
and twang's, Joanna wrote a great paper on twang therapy. Like, so if I talk about the quality, it's kind of giving them an overall picture of what I want when AES narrow seems a little bit too technical for them.
Right.
I use it like that a lot.
Yeah, I use it like that as well. And I think it's also what it sort of shows us when we learn the qualities and how each of them is a recipe with different ingredients. Then when you listen to the patient in the evaluation, you're hearing their current recipe,
Mm-hmm.
their attractor states, and then you're determining what new recipe will benefit them. And
Mm.
so you're actually using the Estill model, but sort of making it your own and really individualizing it for the patient. And so it gives you, I'll even put it in a little chart so that I'm like, okay, we're targeting this. Well, wait, what is that? That's twang therapy. Or wait, what is that? That's, sob or whatever else. So, and sometimes if you teach a quality, like Cari said, rather than breaking it down into the figures themselves, there's so much flow on effect from one figure to another that you can be having them tilt their thyroid and it retracts their false vocal folds and vice versa. And so if they're doing the opera quality, they may never sing opera in their lives, and it's not necessarily the only opera way to sing either, right? We know that that's not the way that the Estill model is designed. But now the patient has access to so many new tools, whereas before they maybe came in kind of like, I have a voice disorder. And now they have this whole new posture and understanding of effort. And it's really effective.
Yeah, we're discussing the interaction now of the system, and the qualities provide us with that interaction, especially and more utility to it than sometimes going to each individual figure or a couple figures.